Our paper is entitled A Proactive Approach to Identify the Exposure Risk to COVID-19, Validation of the Pandemic Risk Exposure Measurement PREM Model using real-world data. Reducing the impact of any pandemic depends on an early prediction strategy to be better prepared, as well as to reduce the burden on our health systems. As authors, we wanted to understand this further, and we proposed a model, the Pandemic Risk Exposure Measurement Model, in earlier work, which we wanted to statistically validate through this paper. The scope of this model is to direct decision takers towards a proactive approach and to reduce the negative impact of a pandemic on the functioning of a country. In our method, we use perceived variables proposed in a previous study by us and applied real data values for 154 countries. We then sought to determine the model's relationship with the level of current COVID-19 cases and the level of current deaths related to COVID-19. To analyze the country's response capacities to the exposure risk to COVID-19, considering socioeconomic, political, and health infrastructure conditions, variables were selected. And in our paper, you can read more about how the variables were obtained and why. Data was transformed to measurable values using a Likert scale of 1 to 5, and SPSS was also used. The PREM model, as derived using perceptions of risk expert participants, features 4 factors, which include the country's activity features as a factor 1, demographic features, factor 2, societal vulnerability, factor 3, and economic exposure as a factor 4. Our results confirm that this 4-factor structure and that the PREM model using real data is statistically reliable and valid. So the study has now moved from a conclusion based on perception to one rooted in reality. So, in conclusion, in this short clip, the PREM model we have designed and developed is useful for policymakers, risk managers, and legislators to know what factors make the country more vulnerable to a pandemic, and, if possible, to manage or set tolerances, limits, regulations, or guidelines as part of a preventive measure. Thank you for your time.